Alright, hi, I'm Dr. Kachi from Nitmed Tutorials, Nigeria International Trained Medical Doctors Tutorials here in Abuja. And I'll be running us through how to take a very good history in our Medical and Dental Council of Nigeria examinations. Alright, so first and foremost, remember at every stage of this examination, remember to always greet your patient. Always greet, create a rapport, introduce yourself on what you want to do, and take permission. It is very important, and there are scores at each stage of your examination. All right, so after that, always make sure you're always with your lab coat. Your lab coat must be on, and your name tags. All right, so your lab coat must be on. You must look the part. It's very important. Showmanship is key. In as much as you know what to do, you must convince your examiners that you know what you do. All right, that's a very important part of this examination. Good clerksmen are good showmen. Remember that. All right, so first of all, you want to take after greeting your patient, you greet your patient, create some good rapport, introduce yourself on what you want to do, take permission. Next one, you take the biodata, okay? You quickly run through, get the full name of the patient, the age of the patient. You don't need to ask the sex of the patient because you can see the patient, so you can always assess if the patient is male or female. Now you want to know what the patient does, the occupation. You want to know if the patient is single or married. You want to know where the patient lives and where the patient is from. You know, when the patient hails from and where the patient resides at, all right? Now, you also want to know the religion. It's very important that you find out the religion. The patient is Christian, Muslim, or a traditional worshipper. You want to know what tribe the patient comes from. After that, you move on to the presenting complaint. What are the complaints that the patient comes to the hospital with? While asking this question, avoid terms like what brings you to the hospital, because what brings you to the hospital is an ambiguous word, which could mean what means of transportation did you apply or did you employ while coming to the hospital. Okay, so ask what your complaints are there any problems, what's the reason why you're seeing a doctor today. Okay, ask very direct questions. Okay, and while asking questions in your presenting complaint, always strike a very good balance between asking open-ended questions and close-ended questions. All right, for most of your history taking, you should dwell on asking open-ended questions. For example, what are the problems today? Okay, what is a complaint today? Okay, the patient tells you, I feel abdominal pain. You say, okay, can you describe this pain? Ask open-ended questions. Only use closed-ended questions to narrow down and ask specific questions to direct your patient. Remember, as a rule of thumb, never interrupt your patient. Never interrupt your patient, no matter what. However, you must strike a very good balance between not interrupting your patient and redirecting your patient when your patient is derailing off the course of a good history taking. All right? So after getting the presenting complaints, you must not write more than 4 presenting complaints, okay? So maximum of 3 to 4 presenting complaints. Every other complaint, just get the chief complaint, while other complaints should be included as associations in the body of your history. All right, so after getting the complaints and the duration, you must arrange these complaints, remember, in chronological order. All right, so after getting these complaints, you move on to the history of presenting complaint. Here you try to get better picture of the challenges or the problems this patient presents to the hospital with. Here you want to follow your 5 C's. All right, first you want to characterize the complaints. All right, so we have different tools of characterizing different complaints. For example, when we're characterizing pain, we go through the acronym Socrates. Okay, we want to know the site of the pain, the onset of the pain, the character of the pain, radiation or referrals of the pain. We want to know associated symptoms. We want to know the timing, if there's any particular periodicity of this pain. We want to know exacerbating and relieving factors. And we also want to know the severity of this pain. Okay, so first of the C's in the history of the presenting complaint is to characterize your complaint. After characterizing your complaint, we move further to elicit the cause of this complaint. We want to know, has this problem, has it been getting better over time? Has it gotten worse? Or has it remained same over time? Okay, we want to know, has this moved further to involve other parts of the body? Okay, so we want to know the cause, the progression of this complaint. After that, we want to elicit for the cause, and the questions to ask to elicit for the cause will be based on a basic knowledge of the pathophysiology of diseases. So it's based on your knowledge of etiology of diseases, causes of diseases, that will guide you in asking questions. Okay. For example, if a patient is in pain, you want to know if there's a history of trauma, if there's a history of bite or sting. If patient has had this kind of pain before, you want to ask different questions that will help you narrow down on particular cause of this pain. So that's the third C, cause. The fourth C is complication. Now, for complication of your symptom, you want to ask for both medical complication and the psychosocial complication. You want to know, are there any problems this patient has, in medical challenges that ensued as a result of this particular complaint? For example, if a patient has an abdominal distension, if a patient has a progressive abdominal distension, and over time, this has worsened to cause difficulty in breathing in this patient, that difficulty in breathing is as a result a complication of the abdominal distension, which is the primary presenting complaint of the patient. Furthermore, we want to ask for psychosocial complications. For example, a patient who has a particular illness, we want to know what is the impact of this condition to this patient. We want to ask, has it stopped you from going to work? Has it stopped you from being engaged in normal activities? Has it caused you to change your job? So we want to know the psychosocial impact of this complaint to this patient, because we are treating a patient and not just a case. All right. Furthermore, we'll go to find out the care the patient has received so far. So we'll ask the patient, what have you done concerning this? The patient might give you history of self-medication, might give you history of visit to other private facilities, other hospitals, other health centers. Okay. So after getting that information, specifically ask questions to find out use of herbal concoctions or unorthodox therapies, because most patients will not volunteer that information unless when asked. Okay, so never forget to find out the history of care patient has received for presenting complaint. All right, so after history of presenting complaint, we'll move on to past medical and surgical history. All right, so we want to know if there's a history of similar symptoms in the past. All right, we want to ask patients if you've had this kind of condition in the past. All right, so we progress from there. We want to know if there are any history of any known chronic medical disease. If the patient says no, you have to specifically ask questions. You want to ask, are you hypertensive? Are you diabetic? Do you know your blood group? Do you know your genotype? Are you epileptic, or do you have any seizure disorder? Are you asthmatic? Do you have peptic ulcer? We can use the acronym as SHAPED. S for sickle cell disease, H hypertension, A asthma, P peptic ulcer disease, E epilepsy and seizure disorder, and D diabetes mellitus. Okay, so we want to ask for history of this common chronic medical disease in this patient. All right, so we progress. We want to know, has the patient been admitted before? If the patient says yes, we want to know for when, for what the patient was managed for, and how long the patient stayed in the hospital. All right. If a patient also volunteers a history of a chronic medical disease, we must state when the disease was diagnosed, what the patient is currently on, okay, and where the disease was diagnosed. So when the disease was diagnosed, that's the year, how many years ago, how many months ago, how many days ago, where it was diagnosed. Was it diagnosed in a private hospital? Was it diagnosed in a public hospital? Was it diagnosed by the patient by using some test kits? All right. And what was done? What was the therapies that were given, okay, for that patient? All right. So we want to ask for history of past surgical history. Okay. So we want to find out if patient has had any surgeries in the past. If yes, what was the surgery? When the patient has the surgery, and were there any post-surgical complications? All right. Furthermore, we want to ask, if the patient has had surgery, we want to ask for anesthetic history. If there's history of anesthetic complications, we want to find that out. Quickly, we move on to ask for family history, okay? We want to know the position of the patient in the family. What type of family? Is it a monogamous or polygamous family? We want to know if there's any family history. We want to know the states of the siblings and the parents. We want to know if the parents are alive and well. If they are dead, we want to know the cause of death and when they died. The other siblings want to know their state of health. We also want to know if there are similar symptoms in family members. We also want to get the history of chronic medical diseases in any member of the family. All right. So after that, we move on to social history. We want to ask for alcohol history. And if a patient is a positive alcohol history, we have to quantify alcohol intake. Okay. We'll quantify the unit of alcohol consumed. Use the formula. Unit of alcohol consumed is equal to percentage alcohol by volume multiplied by volume of alcohol in mils divided by 1,000. Okay, so we want to quantify the volume of alcohol consumed in terms of units so that we are objective in our assessment. All right, so if the patient also ask if the patient smokes. If the patient smokes, we want to quantify the amount of smoking. All right, the quantity of cigarettes smoked. Okay, so we use the formula smoking in pack years is equal to number of sticks smoked times number of years divided by 20. All right, so we want to quantify any of these things that we get. We want to also ask for patient's occupation, and we'll ask any other social any other history as regards lifestyle pertaining to the patient's primary complaint, a history that will guide us to making a diagnosis or guide us in planning a treatment protocol for this patient. Okay, so social history can also give us an idea of a patient's socio-economic stratification that will guide us also in planning for this patient. All right, so you also want to know drug and allergy history. So you want to find out if a patient currently on any drugs, if a patient currently reacts to any drugs, and if there any history of any allergies. So if you have that history, you have to take it down. Right. Furthermore, you want to review systems, okay? Systemic review or review of systems. You want to ask specific questions in other systems not captured in the body of the history, all right? So you capture systems, take the central nervous system, musculoskeletal system, hematologic system, respiratory. Depending on the system that was not captured in the body of the history, you ask specific questions, 2 or 3 questions in the review of system. Then further, now there are few modifications in taking history for some other specialties. For example, when you're taking history in obstetrics and gynecology, you include things like a brief obs and gynae history after your biodata. So you want to ask the patient's last menstrual period, when the patient last saw her menstrual period. You want to find out if the patient, the parity of the patient has given birth before. If the patient has given birth before, you want to find out when was the last childbirth or last confinement to bed. You also want to find out the patient's parity. You want to find out, and you want to use the last menstrual period to estimate the gestational age of a pregnant woman, and also to give her expected date of delivery. All right. So those are the few things that you add following biodata for obs and gynae history. All right. Also, in taking a history for any woman, we must also note a past obs and gynae history in the body of the history. All right, it's very important. Whether or not the woman is presenting in a surgical clinic, a medical clinic, we must always take the history, past obs and gynae history from the woman. All right, so and while taking gynae history, don't forget your 4 Ds: the history of dysmenorrhea, history of dyspareunia, history of dysuria, and history of discharge PV. Also ask for history of hormone use, history of contraceptive use, history of knowledge and history of contraceptive use, knowledge and history of pap smear or any cervical screening or any other test for any malignancy. All right. So also, as a specialized history for pediatrics, remember to also state in the biodata the informant and the reliability. Always state the informant and the reliability if the history is not volunteered by the patient. If a volunteer is not the patient, then you must always state the informant and the supposed reliability of the information you are receiving. All right. So also in taking history in pediatrics, just following the history of presenting complaint, you must also take history, prenatal, natal, and postnatal history. All right, because it will guide you in making diagnosis in children. All right, so you must take prenatal, natal, and postnatal history for children. You must take history of developmental history. You must take immunization history, and you must take history for nutrition for children. All right, so history taken for children is a little different from conventional history taken in adults, and we capture a lot of that in the tutorial classes, all right, which we may not be able to capture in all our videos. All right, so that's basically some modifications you have while taking history for other specialties. All right, so that's how much you can take for this video. For the want of time, we cannot make a much longer video than this, but for more information and to get more tutorials from consultants and other members of the team, you can always visit Nigeria International Trained Medical Doctors Tutorials, where you can get the best of preparation and the best of group discussions, because we don't only give tutorials, we also encourage group discussion amongst the students, amongst the fresh doctors, such that while they are while they get to the exam venue, they are very, very prepared to come out very successful. All right, so I hope to see you in Nitmed tutorials, and stay good, stay safe. Thank you.